The prevalence of CVD in India has risen markedly over the last few decades, with numbers fast rising. Dual antiplatelet therapy with aspirin and a P2Y12 inhibitor is the standard of care to prevent thrombotic complications in patients undergoing percutaneous coronary intervention. Antiplatelet agents have significantly improved patient clinical outcomes, substantially reduced atherothrombotic events and cardiovascular mortality rate. The potent and greatly efficient oral antiplatelet agents come with limitations like increased bleeding risk, delayed onset of action, especially in the presence of nausea or vomiting, slow conversion to active metabolites, and unpredictable platelet inhibition. Intravenous antiplatelet agents quickly counteract activation and aggregation of platelets and are useful in peri-PCI period where fast onset of action is desired to further reduce the risk of stent thrombosis. Canreal is the only currently available intravenous P2Y12 receptor inhibitor with potent, predictable and rapidly reversible antiplatelet effects. Canreal is indicated for use in patients with coronary artery disease undergoing percutaneous coronary intervention and has shown significantly lower bleeding risk than GP2A3B inhibitors. P2Y12 activation leads to a conformational change of glycoproteins on platelet surface, eventually leading to platelet aggregation. Blocking the ADP binding site by P2Y12 antagonists maintains cyclic AMP intraplatelet concentrations at a high level, thereby keeping platelets in a resting state. Studies have demonstrated that Canreal causes 98% inhibition of platelet aggregation. Canreal has a rapid onset of action within 2 minutes of IV administration and a quick offset within 60 minutes after discontinuation. Canreal has a short half-life of 3 to 6 minutes and is entirely independent of hepatic function. Canreal is especially suitable for patients with presumed impaired oral absorption of drugs, like patients receiving morphine in presence of nausea or vomiting, intubated patients, patients in cardiogenic shock, or in those not adequately pre-treated with oral antiplatelet therapy. Canreal can be administered as a 30 microgram per kg IV bolus over 1 minute before PCI, followed by 4 microgram per kg per minute IV to be continued over 2 hours or duration of PCI, whichever is longer. A plethora of studies conducted over the past 2 decades have demonstrated that the use of P2Y12 receptor inhibitors in high-risk patients with coronary artery disease, such as those undergoing percutaneous coronary interventions or presenting with an acute coronary syndrome, significantly reduces short and long-term ischemic events. Landmark trials with Canreal, like the Champion PCI platform and eventually the Champion Phoenix trial, provided primary evidence of efficacy that led to the approval of Canreal. The American Heart Association guidelines suggest that intravenous Canreal may be a reasonable choice to reduce peri-procedural ischemic events in P2Y12 inhibitor-naive patients undergoing PCI. Canreal, the only intravenous P2Y12 receptor inhibitor currently available, superior to clopidogrel in reducing ischemic events without an increase in major bleeding events, allowing an easy transition from IV to oral P2Y12 inhibitors with no dependence on renal or hepatic function. Canreal, the sooner the better.